So kids would come into my office, and the most common thing when I came out of residency was parents were a little less sophisticated, hadn't learned quite as much about mental health at that point, and they would come in, and the biggest complaint as they came into my office would normally be some kind of behavior problem, usually a defiant or an irritable kind of kid. Now, what they taught me in residency, my psychiatric training, was that you diagnose kids with oppositional defiant disorder, and then you set up a behavior modification kind of program for the parents of how to deal with that. Consequences and rewards and tight structure and timeouts and all that kind of stuff. So I would do that, and I slowly started to discover over time that that worked for a certain percentage of kids, but there were a lot of kids that just didn't respond to that. And in fact, a lot of the times, they actually got worse when we used those kind of techniques. And unfortunately, that's really just about all anybody was teaching in residence programs, psychology programs, of how to deal with the defiant kind of kid. So I started experimenting a little bit. And with time, a little bit more knowledge, a little bit more wisdom, it's one of those kind of things where everybody here, if you look back 10 years on your life, you can think about the opinions that you held 10 years ago and nowadays say, well, I don't believe that anymore. And it could be something that you passionately believed 10 years ago. It could be a political belief, a religious belief. And 10 years of experience and wisdom turns you around to where you can now say, I don't believe that at all anymore. Which makes us all want to stop and question for a moment how strongly we believe the things that we believe right now. Because are we going to believe the same thing 10 years down the road? Or are we going to be able to chip out the nuggets of truth from the things that are off the mark? So over time, as I gained experience, I started to realize that that original population of kids that I saw, that I was just diagnosing as oppositional defiant, that a certain percentage of those kids actually had mood disorders. They were mildly depressed. There may have been a bipolar kind of variant. And the reason they were defiant is because they were grumpy and irritable most of the time. So the best kind of analogy, with apologies to any women in the room, is PMS. That you can take somebody that is a normal, pleasant, happy person most of the time, and 4 to 5 days of the month, they're hard to live with, they're irritable, they're touchy, they think everybody in the household is not pulling their share. Okay? Does this sound familiar to anybody? Okay. A chemical change turns you in to kind of an ornery person whose personality seems a little bit out of whack. So I started treating some of those kids that I normally would have diagnosed as oppositional defiant, put them on small doses of antidepressants and mood stabilizers, and all of a sudden these kids would come around. And they were pleasant, they were cheerful, all of a sudden they were being compliant for their parents. But there was this other percentage of kids that didn't respond to that. Or they just responded minimally to the antidepressants. They'd be a little bit better, and yet were still clearly overloaded, defiant, not doing well at school, not doing well at home. So over time, I started to experiment with these kids, thinking that everything that I had been trying is not working so far. I'll often give the analogy to parents that they've been trying the same parenting technique, it's not working, and so I'll ask them, if every morning you woke up and opened your front door and a baseball hit you in the forehead, what would you start to do? It takes them a little while sometimes, but the idea hits them that, oh, maybe I ought to try something different. So I started experimenting with different techniques with these kids, still not quite really understanding exactly why they weren't responding to either the meds or the behavior modification. The thing that I found is that a certain group of kids, they had a lot of the same characteristics. Parents uniformly would describe them as defiant, irritable. At school, they often got labeled as being lazy, not wanting to do the work, underachieving, sometimes defiant with the teachers as well. But what became obvious over time was that these kids did change the way they reacted depending on the environment that they were in. So the parents would describe to me that this year in school, they're defiant and hard to deal with, but last year they had this teacher that just knew how to work with them. The parent never really knew exactly what that was, but they knew that that year went well, and it was maybe the only good year this kid had had in elementary school. Or the parents would describe that summers seem to go pretty well. Or we always notice that when the brothers and sisters are at grandma's house and this kid is just home by himself, that he seems to do pretty well. Or weekends or Christmas vacations, or any time there was reduced pressure on these kids. So I developed a name for parents, and you'll hear me use this from time to time, of kids that I describe as being in a circuit overload kind of category. They're not exactly defiant kids, they're not exactly mood disordered kids, but circuit overload is what describes it. Too much information coming at them at once, too much pressure, the pace of what's happening in the classroom is too fast, they're not understanding the instructions, and the circuits get full, they get tense and overreactive. We all see these kids at TLOS all the time. I think we're getting a better understanding of them. I read a book along the way that helped a little bit. Have any of you read the book The Explosive Child by Ross Greene? Okay. A psychologist at Harvard that basically independently was coming to the same kind of conclusions that I'm talking about, where he had this subset of kids that just never responded to the normal techniques. And I think if you read the book, most of the kids he's talking about, I think, probably were either just temperamental kids or in that mood disordered spectrum. And I discovered that not all of the techniques that he described really fit for this other population of kids that I was talking about. They helped some, but they weren't always the whole answer for it. So, a little more than 5 years ago, I wound up going over to New Haven and started taking some of these philosophies that I'd learned in my private practice with these kids, and realized that a pretty good percentage of the kids that were coming there, and I would guess most residential treatment programs, fit into this category, which I've since labeled as processing kids, which you're not going to find in a book, you're not going to find as a diagnosis anywhere, but at New Haven over time, Carl and Janet and I are used to this, that in the treatment teams, you would throw out this question of somebody that wasn't quite responding, is this a processing kid? Is that why they're not coming around? And initially, I think there was a little bit of resistance to that idea, because we were all used to doing things a certain way. We were used to seeing kids a certain way and intervening in a certain way. And even over there, in general, it was a lot softer, nurturing, relationship-based approach than a lot of treatment programs. It was still hard to get out of that kind of model. And it's back to that, if you only have a hammer, everything looks like a nail kind of an approach. So if somebody gets defiant, we understand defiant. We know how to deal with defiant, and these are the techniques we've been taught. But these kids didn't fit into that. So we'd see these kids that would drag on month after month, spinning their wheels, blowing up, overreacting. Staff often didn't like them. The other kids often didn't like them and would scapegoat them all the time for behaviors. And I think certain people became converts quicker. I think Carl was one of those, and I think Janet was one, to start to realize that we need to look at these kids differently. Maybe you were onto this long before I was, Carl. So we started teaching these different techniques that I'm going to go into in a little bit while here, after a while. But the important point is that once everybody started to get on board, we started to see these kids come around. They would react differently to the interventions that were going on. I'd seen the same thing in my private practice. And I remember one case in particular where I started teaching what I described as a softer parenting technique with these kids and started to have success with it. And I'd had this boy that hadn't come in for about a year, partly out of frustration from the parents, because we had tried everything in the world with this kid and nothing worked. He's about 10 years old. He was angry, blowing up, terrorized the other kids in the home, having problems at school, angry with these teachers. Mom had no idea how to manage this kid, and she was just about on the edge of a nervous breakdown herself. There was a lot of other psychiatric disorders running in the family, and Mom was pretty convinced the kid was bipolar. I must have tried 14, 15 different medicines, different combinations. Absolutely nothing worked. So finally she comes back in, and I've had this year where I've been experimenting with these other techniques to see what would happen. And just on a whim, I asked the mom to do a little bit of testing on him at school just to make sure we weren't missing something, and also suggested that she just experiment with these techniques. And she was a little bit hesitant because nothing had worked, and I think she was maybe losing a little bit of confidence in me as well because I wasn't helping her. But I said, just give it a try. And I explained the techniques. Go home and do it for 1 or 2 weeks. Teach Dad. Try to get the other kids that are at home to do it as well, and let's just see what happens. She comes back 3 or 4 weeks later, walks into my office, sits down, and immediately bursts into tears and says, "What have I been doing to my child all of these years?" Because this kid melted when she started using these techniques. Now, I have seen that over and over and over again in my private practice, where kids are maybe a little less complicated than what we get at Telos. But the same kind of techniques apply, and they still work for these kids. Now, if you don't catch on to this, then the kids wind up getting overdiagnosed and overmedicated, which is pretty typical for residential anyway. We see that out in that hurricane of life, that these kids are out of control. They're tried on tons of different medications, labeled as just defiant kids, and often labeled as bipolar. And that's what we would see with those kids coming into New Haven. I remember one kid in particular, Janet. I don't know if you remember her, but she was a younger one, maybe about 13 years old, had clear-cut processing problems, and I think she was on 8 meds when she came in. And we just slowly took off one at a time, as we used this approach with her, got her off of all of her medications by the end, and she looked exactly the same to us, except that she was behaving better with the techniques that we used. So at Telos, what's our vision for this? Okay, number one, not everybody gets this. And this doesn't imply that this is genius or rocket science or anything. It's just something I stumbled along the way that works. But programs don't get it. And sometimes I don't think they really want to get it because they want to keep using the same techniques that they've used in the past because they're comfortable with them. But I think if we can get this as a group, and I think a lot of you do, just from some kids we've worked with, and with the way that our program works anyway, just the kind of values that we teach and the way that our staff work with kids, I think we can do this better than anybody else. The kind of symptoms that you see with these kids are, number one, the social cue kind of delays. And that's, I misread people. I don't always catch the facial expressions. I don't realize when somebody is bored with what I'm talking about. I don't always realize when somebody is a little bit irritated with me. So they misread people. They'll sometimes make comments that are just a little bit off the mark of the discussion. They may not always catch the jokes and the sarcasm. I'll often joke with kids, not only to put them at ease, but because I'm watching to see if they're really catching what I'm saying. And the higher the level of the humor, the better that they can catch. But some of these kids, they'll catch the lower level jokes, the slapstick kind of humor, but you do any kind of abstract humor with them and they're lost, they're not catching it. And they'll either get irritated or they'll think you're being mean with them or sarcastic as you're doing it. They tend to have rigid thinking. Now there's a difference between rigid thinking and defiance, and it's an important distinction as we look at our kids, because a lot of them will label as defiant and we're off the mark. Rigid is, I can only see it this way. I may be willing to do chores and what you ask me on the unit and be compliant, but on certain things, I'll just dig in. I can only see this, tunnel vision, and there is no way you can convince me of anything else. You'll often hear that it's not fair coming from the rigid kids, and they really aren't truly defiant at heart, because they'll do 80% of what you want them to do until they get to the point where it's not fair, which is completely different than an oppositional defiant kid, which is, I don't like rules, I don't like authority, I honestly don't think you have the right to tell me what to do. Okay, so the rigid kids really aren't in that category. Organization and executive function problems. These are the kids that lose everything, can't find their binder, and it's not just from not caring, which is what they often get labeled with at school. It's the things are just simply not processing right. They lose things, they forget to hand it in. They'll often do their work, and that's where you can really tell resistiveness versus organization, is they do the work, they just forget to hand it in. Poor judgment and decision making. Okay, there's a little bit of an ADD quality there too, but part of it is, and I don't mean to pick on these kids when we do this, but I think it's important that you visualize the person, because then it makes sense to you what we're talking about. That this is where they just continually make decisions in their life that don't make any sense. Sometimes it's impulsive, and sometimes they've thought it out, and they just made a bad decision. Stress-sensitive circuit overload. And the circuit overload phenomenon, again, is that when things are calm and quiet and in control and people are being nice to me, I do well. But as soon as that pressure starts to rise, they get tense, they get overloaded, they start to get defiant, and they start to blow up. And there are some kids that it takes an incredible amount of energy to make an environment that will stop that from happening. And there are other kids that really you make a few mild adjustments and they go from a defiant kid to just a wonderful kid. And we've seen that happen over and over again here. OCD-like symptoms you'll often see come in, and that's actually a little bit of that rigid quality where you'll see these kids, and I think part of it is sometimes OCD runs in the family. Other times it's that because their environment is so confusing to them because of the processing problems, they get very rigid in the way they want things to happen in their environment. So they get real fussy and finicky about certain things. When you think of all the names that we're throwing out, we've had a pretty healthy population of these kids over time, haven't we? Fine and gross motor skills delays, which doesn't always fit. So you'll see these kids that oftentimes want to fit in and want to be involved in sports, but they just simply don't have the skills for it. Frequently need instructions repeated because they didn't get it the first time. Again, I already mentioned that concrete black and white thinking. Sometimes you see kids that they don't necessarily have overall processing problems like that sawtooth pattern, but their IQ is just a little bit on the lower end of the spectrum. And we'll be sitting in treatment team talking about these kids, and finally we'll ask, wait a second, is this kid digging his heels in, or is he just really not getting the concept of what we're talking about? It's because the therapy is a little too abstract for him. We're talking about all of these defense mechanisms that we think he's putting up, and it turns out that he's really just not getting it. Now, what I found in my practice, what I teach parents, and what I want us to do, with some variation, because it has to be a little bit different in a treatment center, and some of these kids are often going to be a mixture of processing and defiance. So it's like they need a softer approach, but they still need the boundaries that we set with them at the same time. So an authoritarian kind of style, which is what most parents do, which is the type of parenting that we might see at a popular treatment program here in town that some people may have worked at, that also has that, if I only have a hammer, everything looks like a nail philosophy, is do what I say, do it exactly the way I say it, and do it when I say it. And if you don't, I'm on you with consequences. Okay? Stern looks, lectures, threats of punishments, and this is often a philosophy of more the parent figure, whether it's a parent or it's staff, is on this side of the room calling out instructions to this side of the room. Okay? Kids that are oppositional, frankly, actually need a little bit of that, although I think there's still better ways to work with them. Kids with processing problems deteriorate dramatically when we use those techniques. So the softer approach, the one that I taught to that mom who then came back and asked, what have I been doing to my kids all these years, is this. Number one, everything becomes more of a kind, arm around the shoulder approach. So instead of calling out instructions from over here, you're right next to the kid, often with an arm around them if they'll let you do it. And there's some kids that don't like that, so you just have to play it by ear. Eye contact, one instruction at a time, softer tone of voice. Not sticky sweet. You're just trying to be kind with them. One-on-one often works better with these kids, so you have them in a group of people and you're trying to do the same thing, and they're looking around the room. They're not catching half of what you're saying. Second, you always have your radar up with that particular type of kid, watching for signs of circuit overload. So you can see that the fists start to clench a little bit, the jaw tightens, there's a little bit of a tone to their voice. Now, if you have a defiant kid, maybe your approach is, I'm not going to put up with that. If you have a processing kid, your approach is to take a step back, reanalyze, reassess the situation, and really ask yourself, is this working, what I'm doing? And if you step back quick enough, you may avoid the blow up and the run to the room and the hold and all the things that happen after that, just by negotiating them with a little bit. Third, you slow things down. So all interactions, you just move a little slower with the instructions that you give, your expectation. You try to avoid those hurry up moments where everybody's saying, let's go, you got to get out of your bed right now. You give them warnings sometimes about time limits. Now, it takes a lot more patience to do this approach. So instead of leaning your head in the door and saying, get out of that bed right now, we've got 5 minutes, it's that you're walking over to them, saying, you know what, bud, we've got to get moving in 10 minutes. I'm going to come back in about 5 minutes to help you if you're not out of bed yet. And you're nudging them to the next task. So it's that idea again of, instead of yelling from this side of the room, I'm right there nudging you from task to task, which you can see takes more physical work that often eliminates these huge emotional spells, which drains everybody if you don't do it. Fourth, you avoid abrupt answers, those quick no's that just fly out of your mouth before you even think about it. And you try to soften the no, which means no may not be the first word that actually comes out of your mouth, but rather, well, let's sit down and talk about that. We'll kind of talk about our time schedule today and what's on your mind. You may still wind up giving them a no, but what they often can't handle is just that quick, immediate, in-your-face no. So basically, and then the next step is compromising more. So avoid the my way or the highway kind of an approach. Try to stay out of the power struggle. And don't be afraid to give in and negotiate a little bit. Sometimes there's this sense of, these are the rules, we can't break the rules. But with this particular kid that doesn't get it, and he's already in this rigid thinking mode, what you want to do is back up and say, is it better to have 90% of what I want, and the kid's cooperating and we've avoided a blow up, or does it have to be down the line 100% and I'm going to do whatever I have to do to make that happen? And then lastly, increased structure and increased supervision for these kids. So if you can see that he's getting overstimulated, there's too much noise in the room, Andrew and Joel are acting up and getting wild, and you can see the kid getting tense, then you need to move them away from there or find some way to tone down the noise. Because it's not that we are coddling and spoiling the kids, which is often what the parents think when they first hear about this approach. Coddling and spoiling is I don't have any rules, I don't have any boundaries, you can do whatever you want. Okay? A soft approach is we have rules, we have boundaries, we have all the same rules we have at Telos. We're just administering them in a very kindly way to help the processing kid get through it. Okay. And then as we're doing that, the whole thing is an experiment. So I would guess that when I get these kids in my office, about 90% of the time, I can guess right that they're really in that category where they'll respond to this. And the parents can tell me that too. I'll describe the techniques. I do this to parents all the time on the phone when kids are first coming in, where I've seen the testing in advance. I'm getting the feeling from them that this kid's in that category. I'll explain the techniques over the phone and just ask the parents, what are the chances that your child would respond to this? They almost always know. And they've never done it, but they almost always know that their child responds to that technique. So we want to do that, but we still want to have our rules and boundaries. And then that other 10% of the time, when it doesn't work, where the parents come back and say, well, Dr. Coates, you're a crackpot. Your theories are no good at all. he's just as bad as ever. Sometimes it's because they really didn't get it the first time and they were doing it wrong. Other times it's because we started out with a processing kid, and through time and bad experiences and bad friends and rebellious kids, they developed an attitude on top of all of that. And then with that particular kid, we're going to need a lot more structure up front to deal with the attitude. And then eventually, once we get the shell broken, we can slowly move back into the softer kind of stuff with them.